Up till this point in the dry eye disease series, we've really only chatted about the background information, the research, and some of the diagnostic testing. Now, don't get me wrong, this is all very important, but let's get into what most people are actually wondering about, which is, what can we do about our dry eyes? In this video, I'll discuss the differences between at-home and in-office treatments and why having a combination of both is certainly necessary in dry eye treatment and management today. Watch on to learn more. Hey YouTube, if this is your first time here, my name is Dr. Natalie Chai. This channel brings you the latest science-based education and treatments in dry eye disease, myopia management, and specialty contact lenses to help you understand why it should matter to you for optimal eye health, function, comfort, and even beauty. Now that we've covered a bit of ground around the types of dry eye possible, as well as how are we able to diagnose, let's start talking about what can we do about it in addition to what can we use. Or of more relevance, how can your eye doctor help you relieve your symptoms? I want to first start by reiterating something very important when it comes to dry eye disease, that once we start seeing signs of dry eye, and certainly once the patient starts noticing symptoms of dry eye, you will always have dry eye. In other words, we know for a fact that there is no cure for dry eye, and the next order on the health spectrum is managing it as best as we can. But let me clarify that even though there is no cure, we can improve the structure of tissues and glands to a certain extent, which will in turn improve the patient's symptoms. I always tell my patients that I have two main goals I want to achieve together with them, and that is, number one, I want to have my patients think of their eyes less during the course of their day, and number two, I want my patients to experience more good days than bad days. So this is important because this sets the expectation that we're looking for improvement with positive progress, but not necessarily a cure. There will be days where your eyes will feel terrible at times. For as long as I can remember, the only therapy available for people with dry eye was eye drops. You'd be directed by your eye doctor to pick something up at the store at the pharmacy because simply your eyes were not producing enough tears. That was basically it. Eye drops still have their place in dry eye treatment today, but we've certainly added a few extra layers on top of that. When preparing for my videos, I always try to deliver my message and information in the simplest way possible with as much relevance. I approach it from the angle of what questions I personally would ask if the tables were turned and I was a patient. So for the purpose of this video, I find that an analogy will help the discussion. Now, at-home versus in-office treatments are best understood by comparing to the model to that of your dentist. There are certain things that require a bit more attention and sophisticated instrumentation and equipment, and others are required for simple maintenance at home. This is the same principle when it comes to your dry eye and maintaining the long-term health of your ocular surface. For some patients, at-home maintenance is enough for symptom management, and for others, I would say the majority of others, a combination of at-home and in-office is necessary. Most of my patients up till this point require a combination of both, as symptoms have started to affect their routine day-to-day life. We're familiar with going to our dentist once or maybe twice a year for a cleaning, a checkup, or maybe something more serious, and that requires a physical in-person visit or multiple visits to achieve the result we're looking for. And now, to maintain those results we've worked so hard for, we need to have a routine of upkeep to take care of our teeth and the whole general part of our mouth, like daily flossing, mouthwash, and teeth brushing. So the model that optometry is slowly moving towards is becoming similar to that of dentistry when it comes to dry eye disease especially. Which brings me to an exciting new announcement of a new sub-series I'll be adding to the channel, and that is dry eye product reviews and more, or something to that effect. I haven't quite thought that one out yet. I will now focus a little more on the products as well as the procedures offered now for dry eye. My goal is to provide an impartial view of details such as the ingredients used, technology involved, and how it can work for you. The at-home maintenance products will include things like topical lubrication drops, gels, ointments, lid wipes, warm compresses, prescription topical eye drops, oral medications, omega-3s, moisture chamber devices, hypochlorous acid, environmental, diet, and overall lifestyle modifications and changes. There's a lot of product out there, so hopefully I'll be able to share some of my favorites and even talk about some of the other things available. Regarding the in-office advanced treatments, these will include the intense pulse light or IPL, radio frequency RF, LipiFlow, iLux, BluffX, Zocky Kit, lid debridement, manual meibomian gland expression, dilation and irrigation, scleral lenses, amniotic membranes, punctal plugs and cautery, tarsorrhaphy, autologous serum, the tear care system, MeiboFlow, TrueTear, and so much more. I am looking forward to starting this sub-series with you and hopefully can help demonstrate the necessity of having some form of both in your regimen. Now, if you're wondering about a certain product and would like me to review it from an optometrist standpoint, please let me know in the comments below. So stay tuned in the coming weeks for the new sub-series in rotation. If you enjoy learning about information around dry eye disease, myopia management, and specialty contact lenses, please don't forget to subscribe, click the notification bell to make sure you don't miss my videos every second Thursday. Take care of your eyes, and we'll see you next time.